So this is a subconjunctival hemorrhage, or SCH in ophthalmology notes. Diagnosing it on day 1 is usually straightforward. But what about when a patient shows up later, like on day 3, because it's changing? I'm an ophthalmologist, and this happened to me while I was on call. And I documented the entire healing process day by day. And even I was surprised by what I saw. But first, what is a subconjunctival hemorrhage? It's basically a bruise on your eye. A tiny blood vessel under the clear membrane of your eye breaks, causing the blood to pool. And this happens on top of the white part of your eye called the sclera. So you have the clear conjunctiva, blood, white sclera. And it can look pretty alarming, but it's usually harmless. Typically, there's no pain, no vision changes, and oftentimes you may not even know that your eye is bloodshot until someone looks at you in terror and asks you, "What is wrong with your eye?" Or you get one of these subtle, "Yes, I can do that for you." And it's like, thank you. We good? So here's a day-by-day time lapse of how my subconjunctival hemorrhage healed, starting with day 1. Initially, it was oval-shaped and slightly elevated. As time went on, something interesting started to happen. The shape changed and it appeared to be getting bigger. So initially, it actually looked worse, which could raise the question of whether or not there was a new bleed. While that can happen, the change in my case was from the blood moving, which I believe was from my eyelids moving across that initial mound of blood every time I blinked, as well as the normal process of blood resorption. But here are a few clues that may suggest a new bleed rather than normal healing. The subconjunctival hemorrhage is newly elevated like a mound. The blood is in a different quadrant of the eye. Also, this is where history can be a really important guide. Maybe there's new history of trauma, eye rubbing, coughing, or vomiting. Or the patient shows you a picture of what it looked like before, and there's a noticeable change. When in doubt, or if there's any questions or concerns, have it evaluated by a qualified eye doctor. All right, so let's get back to the time lapse. There was also a color change with a part of it turning a faint yellow, just like a bruise on your arm or leg. And this next part is why I'm really glad that I documented this. On day 1, the hemorrhage was out in the periphery of my eye, but by day 6, almost a week later, the remaining blood was right by the limbus. So comparing day 1 to day 6, that's a big difference. But at least in my case, it was a normal process of how the subconjunctival hemorrhage was gradually healing. So how did I treat this? The only symptom I had was mild foreign body sensation, and that's really important. Just a mild, I feel like something's in my eye. I actually just thought it was an eyelash on my eye. That was from every time my eyelid was blinking over that initial mound of blood. So I used preservative-free artificial tear eye drops, initially for comfort and then just as needed, and I let it heal. Mm. Mm-mm-mm. Subconjunctival hemorrhages are common, and most of the time they're benign and heal on their own. Here are a few takeaways from my case. First, it changed in size, shape, and color. It took a while to heal, 2 weeks in my case, and mine was pretty small. Larger hemorrhages can take longer. Also, it looked a lot worse than it actually was. I often forgot I even had it until I could tell someone was looking at me kind of funny, kind of curious. They see my friend. Hey, when in doubt, smile, keep it moving, or come up with a really good story. Now, this is really important. In my case, there were no alarm symptoms. But what are the warning signs to look out for? If you want to learn more, click subscribe and check out this video next.